Hi, I'm Dr. Philip Macmillan. Thank you for joining me today. Today, I am having a rant. I am upset with what's happening in Africa. I'm upset with the fact that Africa is not recognizing that currently they are the world leaders in the context of COVID 19. May not have been done by design, but they are still the world leaders in terms of outcomes across Africa for COVID 19. So, what had got me annoyed was a simple Twitter post, and I'll share it with you here now. And it was from a Samantha Power in the USAID. I'll make it full screen. And what they're saying here is Mozambique has reached an astounding 98.4% COVID 19 vax coverage rate among adolescents aged 12 to 17 with the help of USA donated vaccines using an immunization campaign. That's more than 4.7 million youth now vaccinated against COVID 19. Now, on so many levels, this is flawed as far as I can see. Now, this is my opinion. I'm just one person. I'm not a public health expert. But here are the points that I think are very, very important to reflect on. If Africa is not yet aware, the first world did not treat you as friends. When the vaccines came out in terms of COVID 19, they were given to their population first, the high risk. I wouldn't have a complaint about that. But once they started to go down into the low risk cohorts without sharing the vaccines with Africa and some of the rest of the third world, they left them to die. Because remember, at that point, the perspective was that the vaccines were our way out of the pandemic. Without the vaccines, you would have massive mortality. There is no doubt that we left Africa to die. That's the truth. Nobody made a fuss about it. Everyone accepted it. Everyone went along to get their booster doses, to get their children vaccinated before Africa. Up to the middle of 2022, only 6% of Africa was vaccinated. So when we are promoting that we are interested in Africa and the outcomes in Africa, 98%, I don't buy into it. I think that this is something else. Is it that they have too many vaccines in the first world and now it's convenient to share it with Africa? But here is the point, the more important point. As I said, Africa is actually the leader, not the follower. So they have targeted Mozambique, and I'm going to show you where it is so that we are all up to date. It's in East Africa. You can see the full screen here. This is Mozambique here. East Africa, close to Madagascar. Now, when I compare this to what is happening with regards to the coronavirus maps from Johns Hopkins, this is always where I start out, it shows you a picture of why I said Africa is leading the world. This is our up-to-date picture from the dashboard. I'll put it on full screen so you can see it. This is the world today. This is Europe. The red marks are where you have Omicron spreading. So Europe, Japan, North America, South America, there is barely anything in Africa. And certainly in Mozambique, there doesn't seem to be anything happening with regards to COVID-19. And so in reality, Africa has had the best outcomes with regards to COVID-19. That's the truth. They are the leaders, not the followers. Now, I remember early in the pandemic when Africa was not having the mortality that was being noted across the rest of the world. What did the rest of the world say? They said, actually, they're not measuring their deaths. That's why we are not seeing all of these Africans dying of COVID-19, equivalent to what's happening in the US and Brazil. No, because what that indicates, I know what to observe a patient dying with severe COVID-19, they can't breathe for about 2 to 3 days. Are they suggesting that Africans would leave their loved ones at home to just die because they can't breathe? No, they would have taken them to hospital. They would have taken them to where they could get oxygen. And so if they were not in hospital, they were not dying. In the same way, we had the issue with regards to Africa and the Omicron. And in September, I showed this picture. This was the pandemic in Africa. It was over in Africa in September. Even from April 2022, Africans already had their surge of COVID-19 in the form of Omicron, and they got natural immunity. So it takes us back to the question, why then would Africa doubt their position and then vaccinate their youth? 98.4% vaccinated 12 to 17-year-olds. What's the logic in that? In truth, the young people are the lowest risk for severe COVID-19. And so if the question is about protecting them from severe disease, that risk was always quite small. Added on to that, the population across Africa has natural immunity. Recently, Dr. John Campbell was talking with someone in Uganda. The pandemic is over. Why are Africans doubting this success? In truth, the scientific community should be going to Africa to try and figure out what it is that they were doing, maybe naturally, that protected them from the mortality that we saw in the first world. I remember when it came out about COVID vaccines saving 20 million lives. And I said Africa would be laughing. They only got 6% and they had the lowest mortality across the world. Is that actually the reason why they're being vaccinated? So that that can be covered? Because it makes no sense. Why would you vaccinate them at this point when they have natural immunity? The pandemic is 2 years down the line since vaccines had come out. What is the point of vaccinating them at this point? And actually, I would ask, what are they vaccinating them with? Is it the bivalent or is it the original Wuhan virus? This is very, very important. Now, there's another point to this. I have this image here that it took me some time to think about. And this is effectively what it feels like to me as to what's happening in Africa. Here we have a situation where Africa already has natural immunity. That's the branch here of this tree. And what they're doing is they're using vaccines to cut through it. Why would Africa do that? Now, it's very clear as we reflect again on the COVID-19 map across the world that in highly vaccinated regions, you have much higher circulation of Omicron. That's just the fact. You know, we can argue about why it's occurring, and I'm going to explain what my research is suggesting. But the fact is that it is circulating in highly vaccinated regions. The mechanism that seems to be occurring with regards to that is that the vaccine induces antibodies, specifically, the strongest response is against the furin cleavage site. Omicron doesn't use the furin cleavage site to enter a cell. And so therefore you would prime the immune system to target the original virus or the original entry mechanism of the virus and not actually get the benefit of blocking Omicron. Because this is what we're seeing across the world. Mozambique specifically. Now, this was quite remarkable, and I did a whole Substack on this. Mozambique has the second highest rates of HIV in the world. When I show you this image here, and this is the image of Mozambique full screen, you can see that they are just behind South Africa in terms of deaths. So one of the questions I had been asking was, how is it that Mozambique didn't have huge mortality when they had such high levels of HIV? This is the image of what has happened in Mozambique with only a fraction of the vaccination rate, with high levels of HIV since January 2022 all the way through to October. They barely had any deaths. Why would you then, in such a strong position where the world needs to understand how this occurred, why would you then follow what doesn't seem to be working in the rest of the world just because it is the first world? That is what gets me upset, because I'm looking at it and I consider this to be an own goal. Africa is now leading and teaching us about the way that COVID-19, or probably metabolic health, which is what COVID-19 seems to be targeting. But instead, Africa is still following what is happening in the rest of the world. Why can't Africans trust when they have got success? 98.4% of Mozambique youth have now been vaccinated. I will really be interested to see what happens to Omicron circulation in the next few months, because based on the research, it could have an impact on their own broad natural mucosal immunity. These are serious times, and we need real answers. We need scientists who are willing to look at what works and who are not focused just on what they think should work. And that's what we've had so far in this pandemic. The scientific community has ignored Africa, has discounted what has occurred in Africa, and it will come back to bite us, because at the end of the day, it doesn't matter how we achieve success in the pandemic or who leads the way. It's just that we get from A to B with the lowest level of mortality as possible. I wish Africans would just stand up and show us what it is that they have done to get such amazing results across the world. That's my rant for today, and I hope you have a good evening.